Reading part B, question number 1. No introductions, okay? Question number 1. What message is being conveyed in this guideline extract? So what is to be highlighted?
Guideline.
Message.
And message. Okay, so what is the message? Option A, there is insufficient understanding of these systems by most employees.
Insufficient.
Understanding.
By most
Most
employees.
Yes, by most employees. Okay. Option B, employees are the only people capable of operating these systems.
Absolutely.
Only.
Only people.
Only you say is absolute. If there are beginners, don't believe these people. Okay. Then, so option C, these systems are less effective if employees aren't included.
Less effective are not included. Extract from guidelines the core elements of safety and health management systems. Most successful safety and health management system have 6 core elements, all interrelated, each necessary to the success of the overall system. One of those is employees' participation. Employees have unique knowledge of the workplace and must be involved in all aspects of the safety and health management system. For example, setting goals, identifying and reporting hazards, investigating incidents, and tracking the progress. All employees understand their roles and responsibilities under the safety and health management system and what they need to do carry them out effectively. Employees are encouraged to communicate openly with the management and report safety and health concerns. Barriers to participants, example, language, lack of information, or disincentives are removed.
Okay. Most successful safety and health management systems have 6 core elements, all interrelated, each necessary to the success of the overall system. One of those is employee participation. One of the 6 systems, elements, core elements. So where do you have the clue? All employees understand their roles and responsibilities.
Option A. Eliminate.
A is eliminated.
Because it is opposite, right?
Yes.
Opposite to what is said in the text. Okay. Then what else is left?
See.
Only C is left. Where do you have the clue to C? The topic sentence itself tells you, see, there are most successful safety and health management systems have 6 core elements. One of them is employee participation. If one of the 6 is not included, what happens? It will be less effective. To make it perfectly effective, all these 6 core elements should work together. And again, employees have unique knowledge of all those things. All employees understand their roles. And even this tells you, gives you an idea. Employees are important. So answer is there. So barriers should be removed, all those things to make them participate, right?
Yeah.
Clear?
Yes,
If you understand, if you have competency, you have the answer here itself. 6 complements, one of them is this. So there are systems are less, these systems are less effective if employees aren't included. Out of 6, if one element is not included, that's going to be less effective.
Less effective.
Okay. Cool?
Yes.
So we go to question 2. Question 2, the directive informs us that employees
Informs.
Employees.
Option A, don't always have to pay an administration fee.
Always.
Always is not absolute. So they don't always.
So no elimination. Objections are raised. Okay, let's see. Option B, split off the cost of the administration fee with their employer.
Split the cost.
Split off the cost with their employer. Okay. Option C, who change their packaging arrangements?
Making arrangements must.
Each health agency will charge each participating employee an annual fee for administrating their package, which will be deducted on a pro rata basis for each period. The cost of the administration fee, including GST, will be shared equally by the agency and the employee. Health agency may elect to outsource the administrations of the salary packaging scheme. An external salary packaging provider must be selected through a tender process. In all instances, the health agency will require the employee to package salary for the administration fee liability. In other words, the employee recovers 50% of administration fee from the employee. An employee may review the alter their salary packaging arrangement at the end of package year, usually 31st March, at no extra cost. If an employee elect to change their packaging arrangement during the packaging year, they may incur an alternation fee.
So, what is the answer?
B, Father.
B.
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 Topic sentence itself is the paraphrasing of option B. Each health agency will charge each participating employee an annual fee for administering their package, which will be deducted on a pro rata basis for each period. The directive informs us that employees split off the cost of the administration fee with their employer. In all instances, the health agency will require the employee to package salary for the administration fee liability. Again says, split off the cost of the administration fee with their employer.
B. Yes, B.
B, yeah. Don't always have to pay an administration fee is opposite to in all instances they have to pay. This is the opposite of they have to pay at all instances, right? But first one says don't always have to pay, only sometimes. But it says in all instances the administration fee must be paid. This is also particular. Who change their packaging? See, only when. This is see, first one says don't always have to pay, only sometimes. C also says sometimes. Who change their packaging arrangements must pay. But here it says, the text says in all instances they have to pay. Like for example, this is 100%. Option B is 100%. This is 70%. This is 30%. Now the issue is, should they pay the salary packaging administration fees? First option says don't always have to pay, only sometimes. Third option says who change their packaging arrangements pay, means only particular group, only at particular situations they have to pay. Second option says split off the cost of the administration fee with their employer. All the employees should pay. This is all. This is some. This is some.
No, Father.
It is clear.
Okay. For example, now you have to pay toll, right? Toll fee in the roads, national highways.
Yes,
First
Father.
option says always you need not pay the toll fees. Whenever you go, you need not pay the toll fees. Second option says in all instances, whether you go for marriage, whether you go for reception, or whether you go for shopping, whether you go 10 times a day, at every instance you have to pay the toll fee. Third option says only those who are coming from outside the district have to pay toll fee. But the text says no discrimination. Whoever passes through the toll gate must pay the toll fee. Did you understand?
Yes, Father.
Yes, Father.
Yeah, because here it says in all instances, even otherwise topic sentence says each health agency will charge. Will charge means definite factual statement. No excuse. Each toll gate people will charge every traveling vehicle and a toll fee for passing through the national highway. The topic sentence itself says that meaning. Cool. Question number 3. What is being described in this section of the guidelines?
What is being described?
Describe and guideline.
Guidelines.
Option A, different tactics to use with pregnant women who use drugs or alcohol. Yes.
Different
Different tactics.
Option B, the problems mothers using drugs or alcohol cause their unborn babies. Problems caused, okay.
problems.
Option C, why birth control information should be given to women with the drug or alcohol issues.
Birth control.
Why?
Control.
Birth control information. Guidelines for the management substance use during pregnancy, birth, and the postnatal period. Exposure to drugs and alcohol may have a serious effect of the fetus is a very early stage of pregnancy, particularly before the first missed period. Therefore, all women with problematic drug or alcohol use should be provided with advice on contraception. Long-acting forms of contraception are generally preferred, example progesterone implants IUDs. This approach will facilitate planned rather than unplanned pregnancy and reduce harm to the unborn child.
So which option?
Option
First
C.
option says different tactics to use with pregnant women who use drugs or alcohol. Those who use drugs or alcohol, some tactics must be taught to them. How to use drugs nicely, how to use drugs
No.
wisely, how to use drugs and see that others don't get the smell.
No.
No.
Okay.
No.
Second one, the problems mothers using drugs or alcohol cause their unborn babies.
No.
Option C.
Yes, it's C.
C.
Birth control information.
Do they show the problems of mothers? Do they speak anything about problems of mothers?
No.
No, this can be eliminated from the topic sentence itself because topic sentence is speaking about serious effect on the fetus in the very early stages of pregnancy, particularly before the first missed period. So, effect. Effect means problem, right? Cause and effect. Okay, the effect, the problem they face is the effect. Why did birth control information should be given to women with the drug or alcohol? Is all women with problematic drug or alcohol use should be provided with advice on contraception. Got it? Clear, right?
Yes. Clear.
I don't know the authenticity of the material. Okay, anyhow, we'll work it out since it is sent to me. Question 4. Foodborne botulism is known to.
Botulism.
Option A. Take a long time to develop in most patients.
Long time.
Patient.
Require a specific course of treatment.
Specific course of
Treatment.
Third one, option C, cause death in severe cases.
Death.
Death in
Manual extract. Foodborne botulism. Foodborne botulism is due to absorption of a performed toxin from the gastrointestinal tract. The timing of symptoms is depend on the dose of the toxin absorbed. Typically, however, onset is 12 to 26 hours, median 24 hours post-ingestion, but can occur from 6 hours to 8 days after eating contaminating food. Foodborne botulism can be associated with symptoms such as nausea, vomiting, diarrhea, and abdominal cramps, followed by constipation. Diagnosis is by detection of the botulism toxin or by isolation of the organism. A defined equine derived antitoxin must be given as soon as possible. Do not wait for diagnostic test. Repeat doses may be given within 24 hours if deterioration continues. There is no specific antibiotic for this condition. Supportive care, including ventilation, hydration, and nutrition, will be required during recovery.
B we can eliminate further.
Father muted.
There is no specific antibiotic.
Take a long time to develop in most patients. How much time it does take?
Muted father.
6 hours to 8 days.
Onset
6 hours
12
to
to
8
20,
hours.
12 to 26 hours. That means 24 hours max. The median means average.
But next.
But can occur from 6 hours to 8 days after eating contaminated food. Can occur 6 hours to 8 days.
8 days.
Does it take a long time to develop in most patients? Typically means what? Normally, generally, majority. Typically,
Eliminated A, right?
it doesn't take, typically means particularly, generally, or most of the
Typically,
cases, it
normally.
takes 12 to 26 hours. But
Yeah,
sometimes,
normally.
exceptionally, Exceptionally, it can take 6 hours to 8 days. Most
Some
patients
people,
take a long
yeah.
time to develop in most patients. Is it true? No, in most patients, typically it takes only 12 to 26 hours immediately, the same day.
Mm.
This is opposite, right?
Yeah.
Yeah.
Yes, Father.
Yeah. Here you are having a problem because of the competence in language. Typically means what? You don't understand, right?
Typically, normally, right?
Typically means generally. Normally.
Okay.
What you say normally? Normally is not the correct word to be used there, because since you are nurses or health professionals, you used to always say normal, abnormal. But normally, no, it is generally. Generally means most of the cases, most of the patients. Okay, typically most of the patients have onset in 12 or 26 hours post initial, but can occur, maybe occur for some people, exception. Got it?
Yes, Father.
Okay. So first is eliminated. Cause death in severe cases. Does it speak anything about cause?
Not mentioned in the paragraph.
Yeah, death is never mentioned. Nobody wants death here. Okay, in this paragraph, no death, only life. Okay. Do you have a death anywhere?
No,
Nothing? No. Yeah. Then which is the answer?
defined history derived antitoxin.
Case
B is
prepared
an
antitoxin must be given as soon as possible. Do not wait
Yes.
for
only
diagnostic.
for
Yeah. Diagnosis is the detection of the toxin or by isolation. Okay. A defined is it? Equine derived antitoxin, all those things.
Derived
When you
antitoxin.
supportive, see the whole portion says a specific course of treatment. There is no specific antibiotic for this condition, but there is specific course of treatment. Don't misunderstand. There is no specific antibiotic doesn't mean specific course.
Okay.
Yes,
Okay.
Father.
Yeah, I think you have misunderstood there. So someone shouting B could be eliminated. See, there is no specific antibiotic doesn't mean there is no specific course of treatment. There is a specific course. What are the specific course? It is given here. A defined equivalent toxin must be given as soon as possible. Then repeat doses may be given within 24 hours of treatment. Since there is no specific antibiotic, supportive care including ventilation, hydration, and nutrition will be required during recovery. Even ventilation, hydration, and nutrition are treatment, right? Part of treatment.
Yes, Father.
Got it?
Yes, yes.
Yeah. That enhancement of the language happens only by practice more. When you practice more and more, you'll get it. Fifth one. Hope you have stamina.
Yes, Father.
Yes, Father.
The standard explains that in the case of living donors,
Living donors.
Standard explains
Living
donor. Standard explains.
Standard explain.
option A, collection can only take place once their history has been taken.
Only
Can
collect-
only take
can
care.
only take.
Only absolute.
Is it absolute?
Eliminate. Yes. No, it's not absolute. It's not absolute.
You should be sure. Then you say,
It's not.
the
Can
collection
only.
can.
It's not only.
Anyhow, we'll keep it. When you read, you'll understand whether it is absolute or wrong. B, a therapeutic goods order supersedes all other collection requirements.
All. All.
What is all?
Absolute. All is absolute. Absolute.
No doubt, right?
Yes.
Option C, interviews must outline everything that occurred at least 1 month prior to collection.
1 month.
1 month periods.
Requirements in relation to the medical and social history of prospective donors. In the case of a living donor, the blood components, cells, or tissues must only be collected from a living donor with whom an interview to obtain the donor's medical and social history has been conducted and recorded in accordance with the following requirements. A. The interview must be conducted with the donor or guardian next of kin by a trained interviewer and should be face-to-face interview. B. The interview must be conducted no more than 30 days prior to 30 days after collection of the blood components, cells, or tissues and must occur prior to any release of the relevant product from quarantine unless otherwise specified in another current therapeutic goods order that applies to the relevant product.
Answer.
C.
A. Answer A.
Answer A. Prior to.
Because C mentioned at least 1 month. Here mention no more than 30 days.
No more than 30 days.
Yeah, no more than means less than 30 days.
Yeah.
Answer A.
Where do you have answer A?
The first topic sentence in case of living donors, the blood and blood component cells or tissue must only be collected from the living donors with whom an interview to obtain the donor's medical and social history. That first sentence.
All agree?
Yes,
This was not this collection can only take place. This is not absolute, right?
Yeah.
Collection can only take place once their history has been taken. After the history has been taken, they can collect. It is not never. It's after the case history is taken, you can collect. It doesn't say it can never be collected. This is scale. You understand? Okay. So that is clear?
Yes, Father.
Yes,
Sixth
Father.
one. Yeah, sixth question, last one. The purpose of the announcement about the video call platform is to
Purpose of the announcement about the video call.
Option A, advise users of changes that are taking place.
Changes.
Guys,
Okay, option B, outline a range of useful features for users.
Range of
users,
Useful features.
Option C, warn users about potential problems.
Problems.
Potential problems.
Usually announcement about the video call platform, is it for advising changes or outlining the useful features or warning about the problems? Just read. See whether you can find an advice or an outline or a warning. Okay, the purpose. Purpose means main idea, okay? Not the secondary idea, main idea. The purpose of the announcement means the main idea of the announcement, gist of the or the purpose of the STO. Yeah.
Important announcement. The
Okay.
telehealth platform will be upgrading on Thursday, 13th September. Health Direct Australia will be releasing version 3.9 of the video call platform. This upgrade will not affect the operation of the video call platform, and you will be able to continue to perform telehealth consultations during the upgrade. Some benefits of the new console include mobile friendly, works well on tablets and smartphones as well as desktops, simpler navigation, fewer clicks, improved functionality, quicker page response times after initial sign in.
Okay. Any idea?
Useful features.
Where will be the
The
primary
name
or
of
main
the-
idea? Where will be the main idea in a paragraph?
topic sentence.
Yeah, topic sentence. Can it be in the second part, last part? So can you say outline a range of useful features? The purpose of the announcement.
This upgrade will not affect the operation.
See, we can elaborate further. There is no problem.
Is there a warning?
No, there is
No, no, it's not warning.
No warning. No warning because they say you can continue using, no issues, don't worry at all. No warning. Only soothing effect is given. Then now advise users of changes that are taking place, outline a range of useful features for users. That is here, right? What is given here? Whenever they ask you purpose or the main idea, it can never be in the second part. It must be in the first part. Topic sentence is the thing. Always, any paragraph, if you understood the paragraph structure, otherwise go through those episodes. That's why I taught it in the initial stage. That's very, very important. Main idea or the purpose of something will never be in the last sentence. When you write a letter, how do you write? Do you write the purpose of that letter at the end?
no.
Purpose paragraph at the end? No, as simple as that. Purpose should be given clearly in the beginning, wherever it is. Whatever you do, whether a letter, a paragraph, a essay, article, whatever, a book.
A, Father.
So it is A.
Some
Upgrade,
It is say
Some
because
changes.
changes,
It is
yeah, they
upgrade,
are announcement. It's an
announcing.
important announcement on Thursday, 13th September. All the health professionals will be given 1 billion rupees each. And at the end, they say maybe you can buy a car, buy a house, or go for a travel and resign the job. All these are the benefits of that $1 billion. So, what is the purpose of announcement? What is the announcement?
$1
$1 billion
million.
That
will
is
be given, right?
upgrade.
Not what you can do with that 1 billion. So, clearly it is given on Thursday, 13th September. Health Director will be releasing version 3.9 of the video call platform. 3.9 means like 2.0 OET, new version. This upgrade again means
Announcement.
announcement. No, announcement means this upgrade means
The
means
person
change,
3.9
changes.
versions.
Changes.
Changes. Yeah, upgrade. Upgrade means change. What is the new upgrade? What is the new change? Okay, version 3.9 is new change. OET 2.0 is the new version. This upgrade, this change will not affect the operation of the video call platform, and you will be able to continue to platform telehealth consultation to the upgrade. Again, upgrade. If you remember, I have given another strategy like keywords. Repeated words will be the main thing.
Yes, Father.
Hmm?
Yes.
And everything mobile friendly speaks about change. Simple navigation for your clicks speaks about new change. Improved functionality speaks about change. Quicker page response speaks about change. If you have gone through those videos or you have attended paragraph structure sessions, you will definitely, without any difficulty, you will say, you will never go to say useful features because that is in the last part. Last part never can be means you cannot write a purpose paragraph at the end of your letter, OET letter, right? So imagine somebody is asking you, the purpose letter of the OET letter is in the beginning of the letter or the end of the letter. You say at the end of the letter. How does it sound?
No, sounds not
As
good.
simple as that. If you know the strategy, that's why I said you have to go do the guided practice step by step. Attending sessions itself or we watching videos itself will not help you much. Main challenge that you face is you watch all the videos, you attend from all the institutes, all the platforms, and it's a mixed up confusion for you. It will not help you. It will give you a illusion of competency. Oh, I have studied so much. That's not competency. Competency, patience, you have to go step by step in training. It doesn't require a long time. Other way about it will take years, but this will require maximum 4 to 6 months. Are you convinced of this? Even in the previous session, I told you most important information will be given in the beginning. Less information will be given in the next line. Then even lesser important or examples or illustrations will be given next. Then will be the conclusion. Triangle, you remember triangle I showed you?
Yes, Father. Yes, Father.
Like this. I don't know whether it is here, but I'll show you one triangle.
Most important information is general.
Yeah, exactly. I have taught it several times. If you remember that, this type of questions very often you have. This is not the case.
Ulta.
Okay. This is the case. First type of paragraph structure. Topic sentence here on top. First, the most important on top. First portion of the paragraph. This is the topic sentence we call it.
Sentence.
Means purpose,
Main idea.
message, gist. All these questions will have
Topic sentence.
here.
Topic
Means,
sentence.
yeah, main idea of the paragraph.
Main idea.
Then you have, after this, what you have after topic sentence? You have
Supporting sentence.
supporting sentence, which means it explains the main idea. Explains main idea or topic sentence. Or topic sentence. PS means topic sentence. That is the second portion. Then what you have?
Developing sentence.
Developing sentence.
Developing sentence. Means what?
explain or illustrate,
Illustrate means prove. Give some proofs.
Example.
Evidence.
Example.
Example.
Example. Evidence. Yeah. Developing sentence. Then next one.
Conclusion.
Conclusion or link or enumeration or whatever you want to say. Okay. Conclusion
Or link.
or
Link.
link or enumeration or summarizing, whatever. That is the last portion. So when they ask what is the purpose of this, where should you concentrate?
Topic sentence.
So if you have that idea, do you have any confusion here in this question? You will eliminate this portion in the beginning itself. Half of it is done when you see it is asking for purpose. And in some cases, maybe you have a different thing. How is it? It will be like second type of paragraph. How will it be? Somebody said enumerate. Enumerate means summarize.
Yes.
Sometimes they summarize, and in the conclusion, they will repeat the topic sentence. In other words, so conclusion, they will be repeating the same topic sentence at conclusion. Same thing will be repeated. Same message, paraphrased. So you have at the end again the summary of the topic sentence or paraphrasing of the topic sentence. But here you don't have it. This is the second type of paragraph. First topic sentence, then summary, summarizing, paraphrasing the topic sentence again. Did you get the idea?
Yes, sir.
For example, if you say Mahatma Gandhiji is the father of our nation in the topic sentence, they will explain why you say that, what did he do, all those his sacrifices, his life and death for our country. Then you say at the end of the paragraph, you say, hence or therefore, Indians proudly respect him as the father of the nation. That same thing paraphrased in other words. Introduce with the purpose, then establish the purpose and state it at the end. Any other clarification?
No, clear for that.
It's clear.